Class, and welcome to our first discussion. Here in week one, you are learning the fundamentals of coding, but before we can go there, let's first dive into the types of settings, because this will matter when you start to document services, bill, code, as well as receive reimbursement. So taking a look here, we have the first being those inpatient acute care hospitals. Now, this is where patients are staying for a longer period of time, 24 hours or more. Now, in hospitals, they offer a wide range of services. You have your emergency department there. Surgeries are also performed there, and you can also think of specialized treatment. So when we're documenting care within a hospital, it's more complex, so that documentation may also be more complex. Take a look at the skilled nursing facilities. Now, here you may see the acronym SNF being used often. Now, in this level of care, now patients may not necessarily need that hospital level treatment. However, they still need some type of nursing care or rehabilitative services. Now, in this case, you may have patients with conditions that they're recovering from. Think of patients may have surgery or trauma where they may need rehabilitation. You could think of physical therapy or occupational therapy as services being rendered there. Look at the third type, those outpatient facilities. Now, this works in the opposite, right? Patients are coming in for services, but they're leaving the same day. Many times you may think of clinical labs. You can think of radiology departments within an inpatient setting as well as outside entities. Also, think of the services being provided. Diagnostic services, lab results, all of those services would be outpatient care. And then the fourth being those physician's offices, which may be the one we're most familiar with, where we're going into a medical practice for a service. Now, that could be a preventive service, right? It could be a follow-up on a chronic condition, or it could be management of that chronic condition. But ultimately, that physician's office would be your first point of contact when patients are seeking health care. Now, as you start to look at all four, this will be important when you start to learn about the different types of coding, right? Outpatient versus inpatient. Looking at the setting will help dictate which code sets you're using and which are most beneficial. Think of higher reimbursement. Any questions? I'm always here, but I'll see you again in week two.